The guidelines change again, ladies, for getting a mammogram, which can detect signs of breast cancer. Now, the American Cancer Society now says women at an average risk should get their first mammogram at age 45 instead of 40, then every other year at age 55. Now, the new guidelines also say women can skip the manual routine checks you get at the doctor because those have been found ineffective. Now, if you're like me, you're scratching your head right now saying, but wait a minute, didn't they tell us kind of the opposite before? So we're going to get your questions answered this morning with Dr. Joyce Gottesfeld of Kaiser Permanente and breast cancer survivor Sabine Meyer, who is a regular guest here on Good Day. Thanks for coming in this morning. Well, okay, first, this whole issue about changing back and forth, how do we navigate this?
Well, it is complicated. And it's stressful for women and for providers to have the guidelines always changing. But I appreciate the fact that there's ongoing research. And the bottom line is patients need to check in with their provider and see what's right for them as far as screening goes.
Okay, so you don't see a headline and just say, okay, this is what I'm going to do. Why is it so important that you talk to your doctor about your own medical history?
Well, you want to know what your own personal risk factors are. Do you have a family history? Is there some reason why you should be at an increased level of concern? And then, you know, honestly, people's own personal anxiety levels and their own culture and their own beliefs factor into their decision making. So you want to have that conversation with your provider about when it's right to start screening, and then you do incorporate the information you get from these guidelines from these medical societies.
All right, doctor, they're not saying that don't do the self breast check every month, and they're not, are they saying to just get rid of all that altogether?
Well, the term now is more breast self-awareness as opposed to breast self-exam. In other words, if you're just getting dressed and you happen to notice a lump, go ahead and tell your provider you want to get that checked out, but you don't have to make a point of doing an exam on yourself every month like we used to tell women to do.
Okay, I see. Okay, Sabine. All right, now tell me about your experience. How was your breast cancer diagnosed?
Mine was actually through a mammogram, and it would not have, I would not have been able to feel it. There was no lump. And I was 44 too,
See,
so
yeah, so it's different for everyone. And you have an important message for women this morning because you've been through a lot and you're a survivor and you're looking great, by the way.
Oh, thank you.
You are. But what do you want to say to just encourage you? There's still a lot of women on the couch who say, I don't need to go get a mammogram.
I tell every woman and anyone I meet that hasn't gone to get their mammogram, go get it. It's something really quick, and it's just important for early diagnosis. I was stage 0 when they found mine, so I'm just incredibly grateful because of my treatment, and I'm fully cured. Yeah. That would not have happened later on.
Yeah, and some women say, well, they put it off because they don't want to find out if they have breast cancer.
Yeah, I hear that. I hear people say that. I think that's,
all right.
Yeah, it's crazy.
Okay. All right. Well, if you want more information about those new mammogram guidelines, you can always visit our website, kdvr.com. But remember what Dr. Gottesfeld said. It's between you and your doctor. Guidelines change, but your own family history, all that stuff is going to remain the same. So talk about it with your doctor. Some great advice. Thank you, ladies.
Yeah, great perspectives,
yes,
too. Really good. Thank you so much.
All right. So it is 8:48 on your